What I have learned from the theatre production of 448 Psychosis, the panel discussions and the symposium. I was really struck by this project because I have worked as a deaf mental health trainer. I've worked with sign language interpreters, I've worked with members of the deaf community and members of the local community. I've delivered varied training from basic concepts such as what do we mean by the term mental health, to detailed complex training with sign language interpreters about how to accurately voice over and interpret in this field. But the theatre production of 448 Psychosis was different because it accurately conveyed to the audience what a mental health patient is thinking and feeling internally. Rather than simply observing them, the audience were able to experience their thought process. So for those who have mistakenly thought that mental health issues means depression, they were able to understand that it also covers things such as confused thinking, hallucinations, and strange thoughts linked to things like anger, sadness, love, and sex. Since humans can think in strange ways, it was really good for the audience to understand the complexities of the term mental health issues. It was also really good to see the changes in the way the sign language was depicted. Some said to me that they thought in the play BSL should be grammatically pure and clear, but I explained that what we were seeing was an accurate reflection of how many deaf people with mental health issues present in their British Sign Language production. Additional layers of meaning linked to the doctor's behaviour and medication issues helped the audience to really think about and to understand a little bit better some of the realities of mental health issues. Some deaf audience members asked me why communication within the play was so unclear and incoherent, but I explained that what we were seeing was accurate. They said they'd never seen these things depicted publicly. And of course that makes sense, since so many of these issues are hidden in hospitals or in the privacy of people's homes. It was good to see people's reactions to these things. Some of those who have worked within the mental health field told me that what they watched was the most accurate depiction of mental health issues they'd ever seen. One woman who works in both the deaf and hearing mental health fields and can use both spoken and sign languages watched Definitely Theatre's 448 Psychosis production and said not only that it was beautiful, but that it was accurate, that it showed clearly some of the awfulness and confusion of mental health issues, and that it was not exaggerated or mistaken in any way. So it's good to see public awareness being raised and to see deaf people understanding the deeper complexities of the term mental health issues, and that it can lead to severe illnesses and to behaviours that can present as strange or bizarre. A personal challenge is that I have been working for many years to raise awareness and understanding in the deaf community about these issues. The theatre production of 448 has sparked a discussion about this within the community. And I've been working for 30 years to achieve a similar effect. People have woken up very quickly. And so in that sense, the production is very successful. The challenge, however, is where people go for help. One deaf woman approached me after the show and said that she had a similar situation to what she'd seen and couldn't discuss it publicly because it was such a taboo subject. She asked for guidance, and I unfortunately had to explain the very lengthy process of having to go to a GP and be referred to the local services, which discouraged her. Regarding the panel discussion, a Lithuanian woman and a Latvian woman approached me and expressed shock and incredulity that we had deaf mental health services and deaf psychologists here. I explained that we had these services here for many years, and they said that foreign deaf people didn't, and that many deaf people didn't openly discuss such things, not knowing what to do about them. I thought it was excellent that the panel openly advertised the services I'm very proud of, deaf mental health services that some people aren't aware of. One woman explained how her husband had been depressed, didn't know what to do, and then recovered. She was very tearful, and I had to be very careful about it. It was a very personal experience that she shared publicly on camera. She was very brave. I believe an area of weakness is campaigning that the government often seems uninterested in. There was a terrible incident about 20 years ago that resulted in government funding, but there's been nothing since. You also asked me about what sort of support the Wellcome Trust can offer. Now, I strongly believe, first of all, I need to be careful here. So, Sign Health, for instance, is not a clinical provision. Psychiatry is, and they're very different. Sign Health offers a limited counselling service. Our service, on the other hand, and I shouldn't say our service, the NHS service is national in places like London, Birmingham and Manchester, and it offers clinical services such as psychiatry, psychology and nurses. It's comprehensive, dealing with things like schizophrenia and psychosis. Sign Health can't deal with psychosis. It has to be dealt with through the NHS, psychiatry and medication. So the Wellcome Trust need to have that explained to them clearly. The number of psychiatrists is limited, the resources are limited, and getting referrals is difficult. And we have to think nationally, not locally. People have to travel quite a distance. So that then needs to be advertised out to people. And further training is also required. We also need to share that having issues is okay and that it's human to have ups and downs. Many deaf people are unsure about that. We also need to be more sensitive about the signs we use, such as the sign for suicide and the signs for eating disorder. I reject those signs. I think they're inappropriate. The sign for disorder is very negative. I would prefer we say eating problem, since the sign problem indicates a hope of recovery. The sign for disorder can cause a person to think that's it, there is no hope of recovery. The same with the sign for suicide. It's inappropriate in this context. We need to consider how to sign more sensitively. For instance, ask, have you planned to die? If people say no, they can then have a chance to respond, but the sign for suicide can have quite a negative and strong impact on people. We also need to be careful about the questions we ask, such as why. We must communicate sensitively and in an open way, and I believe that theatre sign language needs to do that too, so that people feel that they can respond to these questions. Many deaf people don't know how to sign in that way, since sign language can be quite direct. You talk about children, and yes, many deaf children have mental health issues. CAMS, I believe you should invite to get involved. They have asked me repeatedly that they would like to be involved in publicising their services to families, so that families realise that deaf children need communication. Yes, mainstream deaf children could communicate perhaps, but questions of identity, such as who they are, need to be addressed. We're very lucky to have been able to invite guest speakers such as Dr. Sarah Powell. There are only 6 deaf clinical psychologists, and I think the Wellcome Trust would be interested in the limited number of deaf clinical professionals there are. We should be very proud of them. Hannah Wiley, who's a qualified nurse, she's also young. This is very rare. So it's important for the Wellcome Trust to understand that, and that we need to publicise these things and publicise the symposiums. It's really important, I think, to talk about things like the barriers and the limitations that are faced, and the difficult pathways to treatment that people have to navigate. We think of the GPs and the CCG saying no to the provision of sign language interpreters. No, you have to follow this particular step. People not understanding deaf culture, there's communication breakdowns. It's important to publicise those and campaign. And I think that the symposium should focus on how in 20 years we can have a smoother and easier pathway to navigate, a straightforward one, rather than a very long one, which is very typical of the NHS. We have to think about how deaf people actually want to get straight to getting the matter resolved. We certainly need more symposiums, and we need more panel discussions. I think that perhaps 3 out of 5 shows should have panel discussions after them, so that people can understand what's going on. People can learn from them and understand the realities of mental health issues. And it's possible that the information will then spread through the community, so that when campaigners are fighting for mental health issues to be treated seriously, the deaf community is aware of these issues, having seen them in the theatre. It's very difficult for people like me when we're campaigning, because it's so difficult to explain these issues. So we've talked about the marketing, we've talked about campaigning, we've talked about using sensitive sign language, we've talked about bringing in more deaf service users. You see, many hearing service users, even famous ones who've suffered mental health issues, have talked about it publicly, whereas deaf people often haven't. I think about Sarah Kane herself. She very proudly wrote about what she had experienced and was thinking and feeling. We need deaf service users to talk about their health experiences, the different things they've lived through, and I would love to see more of that. So my dreams are linked to actions. We need ongoing training. I'm thinking that perhaps 6 times a year there should be deaf mental health awareness conferences. There should also be self-support groups, private ones, so I think of women's groups for those who've experienced domestic violence, similar to the ones Deaf Hope runs. I think of male self-support groups. There aren't any out there. Mental health really covers a very broad area. Children, adults, the Deaf Forensic Service, elderly people, family issues. The deaf person themselves might be fine, but their family might suffer from mental illness, alcoholism, violence. There's lots of issues out there. And you have to think about how you can choose which stories are appropriate and how to share them. Whether those are family stories or stories about the Deaf Forensic Service or children, or getting more deaf service users to write down their life experiences and their stories. Do you remember Karen shared her story? She was from Dublin, and for 7 years she'd sought treatment and diagnosis and was told nothing was wrong with her. She came to the UK and was finally diagnosed with schizophrenia, and she got medication. And she was relieved because although she'd been telling people she could hear voices, people mocked her because she was deaf. For instance, that story, that deaf people can in fact hear voices and see signing in their head, needs to be shared. It's very interesting, and a lot of deaf people don't know that that's possible for deaf people to experience, the same as hearing people experience hearing voices.